Hello there, my name is Papion. So in this video, we'll try to cover all we need to know about furosemide, or a drug known as Lasix in its brand name. So furosemide is a drug known to act on the thick ascending loop of Henle. So its primary site of action is a thick ascending loop of Henle. There are different kinds of diuretics. Among them, for example, we can see mannitol, which is known to act on the proximal convoluted tubule, and also we have thiazide diuretics and thiazide-like diuretics, which are chlorthalidone, indapamides, and so on. And this thiazide diuretic, known as hydrochlorothiazide, is known to act on the distal convoluted tubule, which is one of the structure of nephron. So among those diuretics, the one that acts primarily on the loop of Henle is known as furosemide or Lasix. So this drug, by acting on the loop of Henle, it will block the sodium, potassium, and chlorine co-transport. By blocking this co-transport, it will inhibit the reabsorption of sodium, potassium, chlorine, magnesium, and calcium. So by doing this, it enhances the excretion of those minerals, which are known as calcium, potassium, sodium, chlorine, and magnesium, including calcium. So by excreting those minerals out of our body, and by also excreting water from our body, it helps to minimize the body's fluid amount, or to minimize blood volume. So it is indicated for 4 purposes. If we have approved this drug to use in 4 purposes mainly. The first one is it is approved to be used in edema caused by different factors. For example, the edema might be due to heart failure, or it might be due to kidney failure, or it might also be due to liver failure. Due to those, edema can be subsided by this furosemide drug. So the another indication for furosemide is hypertension, though it's not primarily used for hypertension as a first line agent. If there is resistant hypertension, one, again if there is heart failure plus hypertension, and again if there is kidney failure plus hypertension, or the glomerular filtration rate of the patient, if it is below 30 per minute, we will give this furosemide as first line. But if the kidney is well functioning and there is no heart problem, then the hydrochlorothiazide will be the first choice for hypertensive patients. So this is the second indication. The third indication is furosemide is also used in acute pulmonary edema, and also it is known to be used for hypercalcemia, which is high calcium content within the blood. So if some patient have a high calcium content within his blood, this furosemide can get rid of that calcium, because it enhances the excretion of calcium. But hydrochlorothiazide does not work with this, because it will not enhance the excretion of calcium. Rather, hydrochlorothiazide is known to be given for osteoporosis, which is a low bone mineral density. Though it is off-label use, FDA have not approved to be used on this purpose, but we will use hydrochlorothiazide for osteoporosis as urgent therapy. So those are the 4 FDA approved indication of furosemide. The other indication which have not been approved by FDA, but we also use it off-label, is for example, furosemide can be used in cerebral edema. It can be used in cerebral edema as well as in ascites, and if some kind of AKI problem, in same scenarios, it might be given to prevent acute kidney injury. So those are the indication of furosemide. When we come to the side effect of this drug is known to excrete sodium amount in our blood, so it causes hyponatremia. Also, it causes hypokalemia because it excretes potassium. So by excreting this potassium, this hypokalemia is related to arrhythmia. So this drug will not be given with amiodarone, because both amiodarone and furosemide, they are known to increase the risk of arrhythmia. So due to this, both drugs will not be given for arrhythmic patients, or they should not be given concomitantly. So the other one is it might cause hypocalcemia. So by excreting the calcium level, it might cause hypocalcemia. So if someone have osteoporosis, there is already a low amount of calcium in his blood. So giving this furosemide for this osteoporotic patient plus hypertension it will excrete the calcium amount within by urine, so it will exacerbate the osteoporosis of the person. So it will not be given for osteoporotic patient. Rather, we will give hydrochlorothiazide for osteoporotic patients. So this is the main side effects of furosemide. Those are common side effects for furosemide, but there we have more serious side effects which are also rare to occur. So among those, for example, the most common one, for example, ototoxicity. So furosemide might cause ototoxicity. Again, it might cause nephrotoxicity. So especially if furosemide or Lasix is given with NSAID, so non-steroidal anti-inflammatory drug, it might cause nephrotoxicity, which is the inflammation of the nephron. Again, it might also cause severe rash, or known as Stevens-Johnson's syndrome. So those are the most common side effects for furosemide. So when we come to the dosage and administration of this drug as initial therapy, as initial treatment, the initial dose should be given is around 20 to 80 milligram per day. It might also exceed up to 600 milligram a day, but in infant dose, for pediatric dose, we might give 1 milligram per kg per dose. So this is all about furosemide for those kinds of contents. If you want another drug to be reviewed, just follow and like, as well as comment me. Thanks.